Yeah, that's a little better idea.
Is that
Okay,
better?
is that better? Okay. That's all right. Don't worry about it. Don't worry about that. I wanted to give it in this position actually, so it helps show the anatomy a little better. Actually, the nerve is this yellow structure that you see extending from this proximal portion here, and it goes under this ligament called the transverse carpal ligament. And here are the terminal branches, the end branches that supply the fingers, and that one motor branch that supplies the muscle. The carpal tunnel itself is bordered by bone on three sides. And on the roof of the carpal tunnel is this very tight band called the transverse carpal ligament. So it's a very unyielding structure or space. Through the carpal tunnel goes the median nerve and all the tendons that bend our fingers. So it doesn't take much to squeeze that nerve. If we get a little inflammation of the tendons, that's one of the leading causes of carpal tunnel syndrome, just a tendinitis. Anything that'll cause any pressure on the nerve by taking any space up within that carpal tunnel will cause the pressure on the nerve. It's the most common nerve compression that we know of. And the common complaints include the numbness and tingling that people experience, more so at night for some reason. There's also burning pain in the hand, wrist, and fingers. The hands fall asleep, where people shake the hand to try to get the feeling back. There's a weakness of grip sometimes, which occurs more in the late stages. And there's pain that can radiate from the hand into the arm and shoulder. Jeannie will get into some of the prevention, but we'll just go briefly through this slide. What we want to do when we're trying to prevent carpal tunnel syndrome is we want to keep the wrist in a neutral or straight position. That allows for the most space for the nerve, most room for the nerve. When we're in this position, in a backwards dorsiflex position or a palmar flex position, we're actually decreasing the amount of space in that carpal tunnel, and the nerve gets more pressure on it and causes the symptoms. So based on that, when we recommend treatment for this, the most common treatment early on is a splint to keep the wrist in a neutral position, straight position, and more so at night because that's when more of the symptoms occur. The other preventative things are obviously minimizing repetitive action of the hand. By forcing the hand and doing repetitive tasks, we're increasing the pressure in that carpal tunnel and putting more pressure on that nerve. The ergonomics and the other preventative aspects, I'm going to let Jeannie, who's going to discuss in more detail, and she'll get into that during her talk. Some of the other causes of carpal tunnel that are not well discussed are multiple metabolic conditions, such as alcoholism or gout can cause it. People with diabetes, hypothyroidism can get it. Vitamin B1 and B6 deficiency. Malabsorption syndrome results in these vitamin deficiencies. Neoplasms such as multiple myeloma, lymphoma, and metastatic malignancy can cause it. Hemophiliacs get it. Certain drugs can cause it. There are certain conditions, vascular conditions that lead to it. Periarteritis nodosa, which is not a very common problem, is one of the more known factors that cause it. And diffuse inflammatory disease, polymyositis, polyneuritis, sarcoidosis, these all are different causes. So there's multiple causes of carpal tunnel syndrome, but the most common cause is what we call idiopathic. There is no known etiology. It just happens for no reason at all. Diagnosis is arrived at by taking a thorough history, doing a physical exam, and certain diagnostic tests, primarily nerve conduction studies, are helpful in arriving at a diagnosis. The diagnosis is usually pretty easy. Patient comes to the office complaining of burning pain at night, winds up having to shake the hand to get the feeling back, and it's relieved with splints. It's a common presentation that we see. On physical exam, we'll go through some of these things. There's a test called the Phalen's test where we put the wrist in that one position that decreases the amount of room in that carpal tunnel for the nerve. And holding that hand in that position for that period of time reproduces the